Good. Friend of the show, guys. Dr. Barry Gordon is the Chief Medical Officer of Compassionate Cannabis Clinic in Venice, Florida. He's one of the top medical cannabis doctors of a very small group. He's the top of a very small and prestigious group of cannabis doctors in Florida, known as the Seven Percenters.
They have a racket.
Dr. Barry, can you hear me? I can hear you. Oh, wait. If I unmuted, Dr. Barry can hear me.
Unless things start changing.
Hang on.
Okay, here we go.
I can hear you. You got me?
I can hear you. I might say a few things. I might adjust your audio a little bit. You sounded a little bit distorted. You sounded great earlier. You look great. You have the nice violet color sunset going down there in Florida, in Venice, Florida.
It is. It's lovely.
There we go. You sound wonderful.
Hi, Dr. Barry. Thank you so much for joining us. And I think it was Techno Biscuit who turned you on to the show, right? Dr. McKenzie?
Indeed.
Awesome.
Yes.
Thank you, Dr. McKenzie, for turning Dr. Barry onto the show.
Absolutely.
So far out. And thank you so much for joining us. I love that you are among the top doctors, the top cannabis doctors of Florida, in that you are providing access to the most number of people. Thank you for doing that.
You know what, Chela, I'll be honest with you. I had no idea that this is what I'd be doing, 3 or 4 years ago. I was a really happy, accomplished emergency physician up in Ohio.
Wow.
But, ER is a young man's game, so to speak. It's not that I couldn't continue to do it, but, when you're still working six nights every month, which was a 7 p.m. to 7 a.m. shift, and that shift work because you're still doing the days and the afternoons too, but I'd like to say nobody should be awake 6 nights every month unless you're playing blackjack or poker in Vegas,
Yeah.
Maybe being a poker pro or something like that. But my blood pressure was 188 over 122, and I could be sitting there eating pizza and laughing with my nurses at 3:30 in the morning. So it had nothing to do with stress.
Wow.
Well, I'll tell you, my sister is a emergency room nurse, or was for 50 years. She just celebrated her 50 years as a nurse, and it is certainly a very high stress and not always the easiest job. And I certainly give a shout out to I honor anyone who can do that. I certainly could not.
No, so thank you for that service.
Absolutely.
Guys, I'll be honest with you. I loved it.
Sure.
I'd like to talk about emergency medicine being very akin to cannabis medicine itself. When I started out in the emergency medicine business, there were literally only 7 residency programs that were doing, teaching emergency medicine back then. And
oh, wow.
People forget that it was the Vietnam War era that literally brought in the whole trauma system. They used to bring you into the emergency rooms in hearses, not because you were dead, but because the EMS, so to speak, used to be run by the funeral homes, believe it or not.
Wow.
And it wasn't until the Vietnam War era and the golden hour concept that we really even began to have emergency medicine. So I like to think that I was a pioneer back then, and I'm a pioneer now.
So it was basically they sent the hearse because they figured you're going to be dead. But in case
they sent the hearse, believe it or not, Dave, because it was the only vehicle that was long enough to accommodate a stretcher.
Right.
So they didn't really start an IV in the field or do any of that. There was a lot of what they called scoop and run back then.
Get them to the place where they could, and that was the most convenient way to do it. Wow, the birth of the ambulance system, right there.
So how did you become a cannabis medicine doctor?
Well, Chela, my experience is, I graduated in Akron, Ohio, and then I went to Ohio State high school and college, and there was cannabis around all the time, so, Akron, Ohio was very close to Kent State, and, I was, 13 in 1969, so I grew up in the quote-unquote drug era, so I saw many of my friends being very accomplished using cannabis throughout their college careers and the like, and really when I got into emergency medicine, I knew that in the 32 years of my emergency medicine practice that I had never encountered a problem of anybody ever using cannabis
Wow.
And coming into the emergency room, surely not a respiratory issue, because you can't suppress the respiratory function with the CB1 and 2 receptors. But I'd never seen a husband and wife beat up each other after smoking a joint together. I surely don't ever advocate anybody driving impaired on anything, of course.
Mm-hmm.
But I had never, the old joke, of course, being if you are impaired from cannabis, you're stopping at a stop sign, you're going to wait until it turns green, right?
Right.
You're not going to drive 95 miles an hour the wrong way down the road.
Exactly.
Right.
The social impact of cannabis I had never seen in my 32 years in the emergency medicine business. And I had never lost a friend or partner to cannabis, not black, white, rich, poor, plumber, painter, paramedic. But I had lost them to alcohol, drugs, women, gambling, tobacco, and all the other substances. And, I like to say that anything can be abused, to danger, salt, water itself. I don't want my 8th grader sitting there playing video games and eating ice cream all day, every day, right? Because I don't think you're going to be a very successful 9th grader, and you'll probably be 40 pounds heavier at the end of the year. So, to me, it's about the appropriate education and use of all substances. Wow. So to me, when I retired from the emergency medicine practice, I was here in Florida, and I had purchased, believe it or not, a laser tattoo removal system. So Dave, you'll see that in the bio when you read it. So I still have the laser tattoo removal system, but the important part about that is that it allowed me to have a small brick and mortar space, so that when Florida passed the constitutional amendment, I had already had a space in which to open up the singularly first practice of cannabis medicine solely for that purpose on the west coast of Florida. So,
oh my God, that's awesome.
Right. So I didn't have a general practice or a family practice. I just went all in to do cannabis education and advocacy. And I'll be honest with you, when I started to do it, I did it from the social side of things because of the 3 reasons that I just stated.
Right.
But now that I've been doing it and have one of the larger practices in Florida, proudly so, daily I see the impact from the positivity of cannabis as a medicine. So I think there's been an evolution even within myself, that I came into it from the social side. And while I'm still a huge advocate from the decriminalization, let's expunge all the past offenses, things of that nature, now I really come out and speak to the positives of the medical benefits of cannabis. So,
right.
The Schedule I designation has always been such a problem for a lot of reasons. But what offends me now is that we've been focused so much on the harm prevention, risk of cannabis. We know the harm prevention and risk side of cannabis. We've known it for 3,000 years. What we need to know now is the effectiveness of cannabis as medicine. And the fact that we've lost 80 years of research on that is what's so offensive to me.
Yeah, I'm with you 100%.
Let me just interject. You did you say that the cannabis does suppress the CB2 receptor? The receptor?
No, it doesn't, Dave. It never
right.
has, and it never
it doesn't.
will.
Right. Okay,
and
so
actually,
wanted to clarify that. Yeah.
Right. And actually, when I see my patients, especially my Doobie 1 patients, and I think Dr. Mike, and I know he's watching and listening tonight, I think Dr. Mike has mentioned my Doobie scale. And guys, if there's anything that is ever going to be named after me personally in medicine, it will be the Dr. Barry Gordon Doobie scale, which is the assessment of patients' past cannabis use. I have a 5D teaching technique in my practice with each and every one of my patients. And the second of the D's is that determination of past cannabis use, or the Doobie scale. But I always start with my Doobie 1 patients by clinically explaining to them about the endocannabinoid system and the fact that those CB1 and CB2 receptors will never control the respiratory rate, suppress respiratory function, and that's the most important safety aspect of cannabis. Always has been, always will be.
Very good. And then the other thing is, with regards to those kids sitting in front of those couches, cannabis sort of just enhances your character. I've always sort of felt that, if you're a go-getter, if you're a creative person, it uses to enhance your state of mind. If you're lazy, it might just enhance that state of mind as well. That's sort of my argument, is that it comes down to, if that's where you're going, if that's where you're at, maybe you don't want to add cannabis to that mix. But I find that more people, and you see it a lot in the media recently, or at least some of the cannabis media, that it's being, it is definitely a stimulant for people who are creative and people who work out. It's all, it comes down to the person, I think, as with the plant, and the dosing and how it affects everybody. So I would just say that. And what might you say to that? That really, they like to blame the plant to make the couch potatoes, but really isn't it just sort of an excuse?
It's interesting about the plant. So it is a plant, Dave. And, I like to say that the shamans were the smartest people in every tribe, right? They were the ones that knew the plants that were medicines and that medicines were plants, right? And that's why they were always revered in every tribe. And cannabis is like broccoli, carrots, any other plant out of the ground, but it has a unique property of when you heat it, it changes the THCA, the acidic form, it decarboxylates into THC, delta-9 tetrahydrocannabinol, which is a mild euphoric, a hallucinogenic, right? And because we're stuck in this Victorianistic and Puritanistic society that we're in, somehow that's viewed as a negative, whereas in many other societies, it would be viewed as a positive.
Right.
So I like to say that 3,000 years ago, when we were being chased by the dinosaurs and foraging for our food, when you rolled the rock against the cave, right, and you went to sleep at night, I would suspect that there was cannabis inside the cave to assist you in your anxiety and relaxation and to go to sleep. So we're stuck in the era of 2019 right now, where big pharma and big alcohol want to dictate the substances that we're allowed to use to achieve that relaxation effect. And I feel, as a doctor for 32 years on the conventional healthcare side, and I still believe strongly in conventional healthcare, but my belief is you can't withhold a plant from people that's safer.
Right. And
it's safer on the short term, and it's safer on the long term. So as a scientist, I had to go, and I didn't know any of this from med school, Chela. So
this is the thing.
Right.
I have to interject.
I didn't learn any of this before retiring from emergency medicine. So, once I started to do my reading, and the Society of Cannabis Clinicians, big 2 thumbs up, joined early, met Dr. Hergenrather at an AMPA conference, met other experts in the field. I took the entire first year after emergency medicine as a residency in cannabis practice, right? And then my second year, I worked my tail off to build one of the strongest practices here in Florida. And now in my third year, much in the strong tradition of medicine, it's learn one, do one, teach one. So now I feel really strongly about being in the teaching phase, not only of the public, politicians, other doctors, which is key, because doctors only listen to doctors. So to me, if there's not a doctor, Dr. Mike is another one. There's other strong, what we call our proud 97%ers here in Florida, but we'll get to that. But the point is, that's what we're doing right now. We're in that teaching phase of making sure that we advocate to doctors for sure, politicians absolutely, teaching patients about all the issues, including the vaping issue that we'll talk about tonight. But my point is, it's an honor to do so. But the point is, it was the invention of the hypodermic needle that changed us from that plant-based medicinal society to the manufactured medicinal society. And now we're into this disaster of losing at least 120 people, every day to overdose. And I know that's an underestimation, because nobody's doing a post-mortem on 80-year-old grandma that takes 2 Percocet at 8 o'clock, has a glass of wine or two. Now it's 10 o'clock. She's still in pain. She doesn't even know if she took the Percocet or not. She takes 2 more Percocet, and then she doesn't wake up. So to me, we're involved in a society where big pharma and big alcohol are trying to call the shots, and they've been very successful at it with government's assistance. But I, for one, at age 63, I've done my time with honor in the emergency medicine business, and I'm perfectly willing to take the risk right now to stand up for this battle. And it is a battle.
It is a battle. How can you believe in modern medicine if modern medicine doesn't know about the endocannabinoid system? You took all this time to learn about it, yet all of these states who have medical cannabis don't require doctors to learn like you did. You took that upon yourself.
Well, you know what, Chad, that's what's so frustrating. And guys, you can read the article. I don't know if it's going to come up in the aftermath. By the way, I want to give you guys a great shout out. So I've been on other podcasts. There was Cannabis Life Radio here out of Florida. We had Ganja Beach Radio here out of Florida for a bit. But I love what you guys are doing. We need this venue. Those of us Canna warriors, not only here in Florida and you guys in California, but I love how you do the afterburn afterwards all across the country. My patients are stunned that I keep up with things that are going all across the country.
Awesome.
With cannabis all across the country. So I want to give you guys a shout out.
Yeah, far out.
That's why when Dr. Mike seriously told me about your show, and I watched you guys 3 weeks ago and have been consistently now a friend of the show. I'm going to remain a friend of the show.
Awesome.
And I'm going to make sure that we get this wider out because we need a consistency of this type of message going out on the political side, on the educational side. And as each state falls, there's a battle to be waged. So as I like to say, we need to pull on the rope together. We have all those people over there with the power and the money and this and that, but we have the people and justice and what's right on our side. So I firmly believe if we pull on the rope together that we'll win the battle. There was a wall of idiocy up here when I started, and the wall of legitimacy was down there, but now the walls are about equal because we've beaten this one down pretty good, and we're building this one up. So big shout out to you guys. And
Thank you. Thank you so much.
That's, we really appreciate that. It actually made our day. that changed the focus of our vibration considerably. Even better.
Listen, guys,
even better. Thank you.
People don't understand there's a risk. There's a risk that goes on when you put yourself out like you and Cheddar are doing. Financially, there's a risk. It takes time. It takes effort. That's why when there's conferences around Florida, if I can get there, I always try to get there. I never charge a dime to get there because right now we're in that mode where people need to fight hard together. So to me, compensation-wise, this, that, whatever. I know that's not why you guys are doing it. I know you're doing
it.
Clearly, that's not why we're doing it.
I know.
Yes.
You gotta make a webinar yourself. You should make some webinars because, like you said, doctors only talk to doctors.
Yeah, that's an interesting idea.
Listen, we've done them, Cheddar. You can look them back, but it's this kind of thing that people pick up on. I did a podcast. Actually, It's called the Podcast with Dr. Craig Hauser.
Awesome.
On Friday. He's out of Maryland.
Oh, cool.
And like I said, I was just going back and forth with Alexis Bortels on Facebook.
Yes.
I would love to invite her out to AMPA in October, you guys too. And I told her, let's go to Disney World and challenge what goes on there because you're right, Cheddar. You can't even take CBD into Disney World.
Yeah. Well, Wouldn't that be fun if we all went to Disney World together with our cannabis tinctures?
Yeah.
Listen, this is the funny thing about that. So what the prohibitionists don't understand is that it's not about lighting a joint up and walking down the Midway and walking up to the Magic Castle and looking up and saying, wow, my Stone. If Stoner really wanted to do that, he would take a 50-milligram sativa capsule in the parking lot. And by the time you take the shuttle and the boat and walk to the Magic Castle, it would be about the hour to the hour and a half that the edible would be kicking in.
Right.
So it's not about the impairment, of cannabis. It's never been about the impairment of cannabis. That's what I was going to speak to, Cheddar, because when you said these doctors don't learn about the endocannabinoid system, they don't.
They don't.
And if you read that article from Florida about their evaluation of the proud 7%ers. And guys, I'm just kind of funny that way. I get whimsical about things. The second I read the article, I already had the T-shirt in my mind that I'm putting up for my buddies and myself down here in Florida.
Good.
I'm a proud 7%er with the prescription pad and the cannabis sleeve or something like that.
I like it.
But my point is that if you read the guy that's making the comment there about it's the pill mill crisis all over again.
Right.
And the other gal that there's the 8,000-pound gorilla in the room. What the 8,000-pound gorilla in the room is that these people have no idea about what it is that I do.
Right.
Exactly.
Right? And further, they're not interested in learning.
No.
And that's fascinating to me from a public policy standpoint, that there's quality clinicians out there that are going to California to learn about acidic cannabinoids, hopefully from Dr. Mitchullam in 2 weeks, okay? Fingers and toes crossed.
Yes.
But there's many number of quality clinicians in Florida that are respectfully integrating this to the benefit of their patients, and they have no idea.
Yeah.
And all they need to do is come and visit my clinic. I've actually reached out to members of that panel by email, invited them personally to my clinic, and have never had a response back. So I haven't been hiding the entire time that I've been doing. I mean, they're not really after me. I do have one of the larger practices in Florida, but I'm established. I don't move from place to place. I'm not fly by night. They know what we're doing.
Right.
I think what they're really wanting to make sure of is that there's not doctors coming in that are operating one place here, one place there, leaving patients behind. And we do have some of those problems in Florida. But in general, the article, what it connotes is just not fair. We're specialists in the field right now.
Exactly.
So, of course, we have the most cannabis recommendations. So,
Right.
Yeah.
Exactly.
It's not being looked at appropriately.
And it's not, we had this problem in California for years. We had a very nicely working gray market, pseudo legal system out here where
With
cannabis,
no regulations.
with ultimately no regulations, people actually got cannabis medicine that didn't poison anybody, and people who wanted it got a card, and that was a pretty good business for doctors to do, was to. A large number of people to see a cannabis doctor were ones that would recommend make a recommendation under the state law. And in talking to Dr. Hergenrather recently, as soon as Prop 64 passed, that changed significantly. It literally precipitously dropped off because all those people went up. I'm going to the shop or I'm sticking with my guy. And then what he was seeing was real patients looking for real medicine. And then he was able to work. Most of the people he sees now are cancer patients, kids with autism,
people living with dementia.
People living with dementia. Also, number 3, I think that's on the list. So,
right. Yeah, I mean, it's interesting, Dave. I mean, we're in different phases, state by state, because,
right.
In Florida, we're into what I like to call the Chicken Little, the sky is not falling phase, right? 250,000 patients in the program, many going to work, paying their bills, raising their kids.
Oh yeah, people hate that.
Yeah, I know, Jeff. But no, seriously, no one's knocking over mailboxes with their cars, running into the ER. No,
I try to do that sometimes, just sometimes though.
No, so people say, why is that? And I say that's because that's how cannabis has always been used in every society. Ancient Aztecs, Mayans, Egyptians, colonial farm, and 2,000 years from now. So, the glorification of the plant on the one side or the bastardization of the plant on the other. It's a political discussion, quite frankly, and it's just no different than how it's always been used in every society. That's why we need to do the appropriate. So, Dave, getting back to your point, Dave, about when we go into legal adult responsible use, because that's another Florida discussion. And I know there's been a lot of confusion about this, so let's lay it out.
Yeah, let's talk about it.
There's three organizations that are trying to move forward with legal adult responsible use in Florida. There's the MILF, or Make It Legal Florida, which is the John Morgan, and then Nick Hansen would be the political guy. Now, Morgan says he's not really in support of that one specifically, but that's how it came out a week ago, 10 days ago. That kind of prompted all the new discussion. Regulate Florida is the one that's supported by the vast majority of the activists in the state. That's led by Michael Minardi, and they're a very reputable organization. They've been working their ass off to get, the petitions, and now they do have Supreme Court recognition of their petitions. And then there's also Floridians for Freedom, and I want to give a shout out to Colby Wise, who has been working a long time on his, his bill as well. But the point is, there are three of them. There are big differences between the three. The biggest difference being the home grow issue that is not included in the Make It Legal Florida, right? That is included in the Regulate Florida and the Floridians for Freedom. So there's a couple other things here and there to it. But this is what I tell everybody about legalization in Florida. If you look at it, we're not going to vote on it until November 2020 anyway, right? So that's November of 2020. Then it's going to go to the legislature for implementation. They're going to write rules. They're not going to want it. They're not going to like it. If Governor DeSantis is in favor, it'll be an easier implementation. But to me, an easy implementation in Florida is a year, right? And then it takes it to January of 2022, right? So that's a long time, and that's with a short implementation. So I think, quite frankly, reasonable is to look at it for a couple, 3 years. So I think 2023 or 2024, quite frankly, is more likely. Governor DeSantis himself said there'll be no legal adult responsible use, which, of course, is what we call it, versus rec is what they call it. But and until, as long as he's governor. But I don't think it's going to hold out for 7 years, but I think 3 to 4 years is a reasonable expectation. There's an important thing about Florida, too, and one of the things that, as you guys know, I sit on Nikki Fried's Medical Marijuana Advisory Committee. She's the Commissioner of Agriculture in the state.
Yeah, I find that's interesting. That's great.
The first issue that we need to work on in Florida is reciprocity, and this is why. When you have people coming down from Canada for 5 months for season, right? You know, it's cold up there and it's beautiful down here. So you guys saw the sunset behind me, by the way. Anyway, right. And Ohio and Pennsylvania and Michigan and all the other states, they have medical programs that don't meet the same criterion that Florida's program does. You can't ask the doctors in the state not to recognize the fact that there's a significant social anxiety disorder with coming down from Canada, where you're getting legal adult responsible use product, and or a northern state where you're getting a 1-to-1 tincture, topical, this, that, whatever. And literally you can't get those products safely on the black market in Florida. So to me, to make a criminal out of Canadian or a criminal out of California or Colorado or any other seasonal resident of Florida is something that I personally can't do, right? Because I'm going to be an advocate and an educator of that patient to make sure that they have safe access to quality product. And that can lead us into the vaping discussion to that extent. But my point is reciprocity, because Florida is a retiree state and also a seasonal state, becomes critical, because you're putting the doctor into a position where patients are coming in looking just to allay the anxiety disorder of not wanting to have to go back to narcotics or Ambien or Xanax or alcohol even. So you can be Canadian alcoholic. And then when they went legal adult responsible use, you say, wow, I don't have to do that anymore. And you get healthier. And now all of a sudden you're going to come to Florida for 5 months. And they want you to go back to being a drinker again. So, you know, to me, it's things like that make no sense.
But unmute myself. Luckily, we're starting to see at least more of the states that are coming online seem to be, at least initially, some of them are starting to embrace reciprocity. Hawaii did it. I think Arkansas has done it. And some of the other states I don't have to exactly, but we are seeing more of them every week in the news. That home grow. Now the two at the Freedom one is okay with home grow, and the other one, and then the one isn't, right?
Yeah, the Floridians for Freedom, and they just haven't had the same amount of support as the Regulate Florida petition has. But they're both very liberal. Both call for home grow. Floridians for Freedom is actually probably the most liberal of all of them. Regulate's had more support, but yes, they both have home grow. But to make it legal Florida, I mean, listen, and this is the most important thing. And if you get back to the Nikki Fried committee I sit on, people ask me what's my motivation for being on the committee. And I have 5 motivations for being on the committee. They're all the same. Protect medical, protect medical, protect medical.
Awesome.
Protect medical, protect medical. Because in other states, as things have gone legal adult responsible use, we've lost the quality of the medical program in some of those states.
Yes, we have.
We've lost the advantage of the tax advantage for the patient, making it accessible for the patient by better pricing, right?
Yeah.
We need to maintain the ratio of products. We need to work on the other minor cannabinoids, right? We need to make sure we have the topicals and the tinctures and even the suppositories, everybody, right? So that's my mission. And the discussion of legal adult responsible use, believe me, I'm surely happy to weigh in on as a physician. But to me, as one of the leaders and early practitioners here in Florida on the medical side, Florida, once again, being very unique because we have an elderly population, a lot of veterans, a lot of Doobie 1 and Doobie 2 patients that haven't used cannabis ever,
Right.
Doobie 1s, or in 30 or 40 years, Doobie 2s. They are going to need instruction. So, Dave, getting back to your discussion of earlier, when it goes legal adult responsible use in Florida, and it will, the educational center, like Dr. Hergenrather's, right, or like I like to think compassionate cannabis clinics, those are the centers that'll persist as the educational centers, or what I like to call the Cleveland Clinic of Cannabis, so to speak, in Florida. And that's always been my philosophy. That's why I don't have 8 Dr. Berry centers all around the state. I really wanted to establish one firm educational center, and now we have opened up our second office down in Fort Myers, but it's not my intention to have a chain of centers. I want educational centers of excellence, so to speak.
Awesome. That's so inspiring.
It's very inspiring, and certainly the right direction, protecting the patients, which unfortunately they seem to be run over in this green rush. And we're hoping trying to change that in California. We just did move the SB 34 through to the full House floor. Gavin Newsom is expected to sign it, so we might be able to get a break on some of those taxes here in California. But let's talk about the regulated.
Everybody's favorite Canada dog.
Oh, hey, the Canada dog. Wait.
Hey, Tiva, show the guys your.
So Patty, my lovely wife, and I, we got a little mini golden doodle, the miniest of gold doodles. She's a 10-pounder.
No.
And she goes with us.
You got Chela's going out of her shorts. You need to hold her up.
Oh.
Holy cow.
Pretty much got her own following around Florida and the whole bit.
So
Awesome.
And Tiva, and listen, guys, Tiva would be the obvious, reason why it's Tiva. And I had to fight Patty off from having indica and baby hybrids. So,
Tiva, I
tell everybody having the puppy is the greatest thing in the world. It takes all the pressure off of me.
Oh man,
nobody cares about me anymore, and I don't have to pay for college for this one.
I love it. Yeah, that's our babies too, for sure. So let's talk about that regulated Florida cannabis market and medical cannabis industry. Now you wanted to talk. Let's talk about the vape. Let's get into it. Let's get into the vaping issue. What we've got is some deaths. Are there any deaths in Florida yet?
Not that I know of. It's interesting about the vaping, Dave, and this is my take on it.
Yes.
When it comes to smoking of cannabis, and in Florida there was a big debate, of course, because we didn't have quote unquote smokable whole flower cannabis available to us early on in the program, because it was felt that vaping would be the safer route of administration.
Yeah.
And what we know is what we know, and I like to make this point. There's anecdotal research over 3,000 years about cannabis smoke, and there's anecdotal research over 3,000 years about tobacco smoke. We know that tobacco smoke does cause lung cancer and COPD. We also know that somehow cannabis smoke does not.
Yeah.
And I like to make this point. I mean, there's the Nashkin study that and there are studies on this. But the point is, if you just look anecdotally, if cannabis smoke caused lung cancer and COPD, we would know it. And I believe that truly. That doesn't mean that smoking anything doesn't have some irritant effects, some degree of chronic bronchitis, irritation. But I firmly, in my at least research, I can't find where cannabis smoke is the same as cigarette smoke. It's not. Vaping, on the other hand, we don't have 3,000 years of anecdotal research on, right? We have maybe 30 years of research from first the e-cigarettes and now all the cannabis applications. So what I'm advising my patients right now is to absolutely positively never, ever, ever buy anything off the black market, because you clearly don't know what the cutting agents are. And I think you guys are reading the same articles as I am with the vitamin E, acetate, additive, the honey gold or whatever. I don't know. And you guys, like I said, you've been reading the same things as I, but anything out of market right now has got the possibility of being tainted. But even in the dispensary world, I tell people, listen, ask about MCT oil as a cutting agent. There is no medical dispensary anywhere that's using propylene glycol, because we know the dangers of that with popcorn lung, with too high of a heat. A lot of it has to do with the heat of the battery also, guys. But the point is, oils are oils. We don't know what we don't know. I used to say that aspirin was aspirin, and then Vioxx ended up being Vioxx. Aspirin was safe as long as you don't take 16 a day. Right. Vioxx, they had to pull off the market. So, that's the same thing to me when you convert flower-based cannabis out of the ground into anything else, right? So until we have that body of literature and research, to me, it's hard to speak to it. But I think right now, the safe, regulated cannabis vape oil market is safe. Why a few people have had the reactions maybe within that market remains to be seen. But I would say on the other side, the unregulated market is absolutely not safe. And I think that's one of the best reasons for a safe, regulated market. I want it to be as horizontal as can be. I want it to still include home grow for those that want to pursue that. But I think when you're getting into the processing of it, there is a role for regulation and testing. And I think that's fair for everybody to agree to.
Well, certainly, if you're going to consider it medicine, I know there's doctors here that we'd like to have that product tested 7 times before we actually give it to anyone as medicine. There was a doctor on my Twitter feed that responded for today's show, saying that we have a hidden pesticides and pesticide poisoning could be part of this, a new pesticide or one that's come in. Some of my sources in the what you would call the unregulated market are talking about this new additive that showed up in the realm last year at the end of 2018 out of China that just seems to timing wise coincide with these instances starting to come in within the last 6 months. And what this additive does is it fools the people who have always looked at their fake carts and said, oh, it's thin, that means it's being cut with something. Yeah. Now, this oil actually is the exact same viscosity and vaping as cannabis oil, so you can't tell the difference. And it's like 1/20th the price. And nobody knows what's in this stuff. So I think it's definitely linked to something that's being added, cut. You're talking about heats. I find it interesting that the syringe is what changed our motivation from plants to pharmaceuticals to chemicals. Right. Technology is what drove that, the invention of the syringe. And here we have the invention of a way to extract these botanical oils or these other elements, and then which opens up the possibility to add things in to make profit or greed for flavor. Oh, for sure.
And they're going to do that, Dave. I mean, that's how the world is rocking, and that's for sure.
And that's how we're going to kill people, like with the with the heroin overdoses. I mean, now we're going to start killing people by having people ingest this stuff in new and strange ways that we have no idea how it's really doing.
You mean that's how cannabis is going to kill somebody?
That's how cannabis is going to not us personally. No, we're not going to.
It's true. And listen, I love our CBD friends. I do. And I want to speak to it, because I speak to two sides of the battlefield. The battlefield of the prohibitionists is our obvious battlefield, and we got them taken care of because our product is not proven to be unbelievably safer than theirs. That's easy, and now we're learning about the effectiveness of it. That's fantastic. But the other side of the battlefield is the CBD field, guys. It is, and we need to be cautious with the two things that we all know about the CBD world. We need to make sure that they have a safe product as well that's appropriately sourced, And we need to make sure that they don't make false health claims. And, you know, I get agitated when, and this is Dr. McKenzie's gig, guys. This is not mine. But only Michael Jackson is THC, right? In the Jackson 5. I love Janet. Janet's okay. But if you look at CBD as Janet, I'm not going to spend $120 to go see Janet concert if it's only Janet. Michael's got to be. Janet's okay, Cheta. But here's
Some
the point
people
about
love
Janet. Janet's all right, but Janet's only Janet. You got to have Michael. But the point is, I want Tito and Jermaine and LaToya and Rick. I want them all. And that's really what the Jackson 5 is all about. So to me, even if you only have Michael when he's 8 years old and you have a 10 CBD to 1 THC tincture, that one of Michael is ABC 1, 2, 3 when Michael's only 8, right? If you don't have Michael there, it's not the Jackson 5. So I love my CBD purveyors. And I know that there are cops and pilots and all kinds of people that can't use any amount of THC. I got it. But my point is they need to ratchet it back with the health claims that they're making about their product. And they need to accept the fact that to some extent, they got to have the same degree of regulation and control that other quote unquote medicines do, or they're just going to be looked at as a supplement. You know, I'll tell you the next big cannabinoid, guys, that we're going to see, and you guys know this already, is THCV.
That was my guess. Yes.
THCV is the appetite suppressant, right?
Right.
And now it's being basically, you know, genetically created by yeast. You know, it was explained to me basically the yeast is pissing THCV.
Wait. I got to stop you. Yeast is pissing THCV?
Yes. The yeast literally, Dave, is like just genetically creating THCV, right? So
wow.
Now it's an isolate, of course, and this goes back to big pharma. Listen, we know big pharma wants every bit of cannabis. We know that. And as soon as they get their grubby little financial hands into it, they'll say, well, what have we all been waiting for all these years?
Right.
But anyway, and what they're going to want to do is they're going to want to isolate each and every one of the CBN for sleep, CBG maybe for Crohn's, THCV maybe an appetite suppressant. And they're going to want to shift it. Believe it or not, the worst thing that can happen, and it won't, because I think, you know, Washington State, Oregon, Alaska, California, you guys will all just leave the union and say, no, you guys do what you do. We got to keep cannabis legal.
We're working
But the point is, imagine Big Pharma somehow convinced, the administration to make it Schedule 2 and make it a drug again. Okay. And only we control it. And even the legal programs in states would have to go away. I guarantee you that's not going to happen. But that would be the most draconian thing to happen. But then what Big Pharma wants? Big Pharma wants to control cannabis for 15 or 20 years.
Right.
They want to control it. They want to isolate it. They want to study it like drugs. They want double-blinded this, that, whatever research. And I say to them, listen, you guys go do what you do over there. Study CBN for sleep and CBG for Crohn's and this and that. And let us know what you find out, and then we can breed that into our plants, right? So that we can contribute with our whole product entourage effect, right? So we'll stay over here while we safely figure out the drug, the overdose crisis that you guys created, that we get people off of this and that. And you guys stay over there and do your research. And then maybe sometime in about 15 or 20 years, we can come together. But don't dare take away what I'm doing over here safely for my patients.
Well, the consensus that I'm hearing from what it looks like the doctors actually using this stuff and talk, in Israel, we need the full flower. Big Pharma is still overhanging that because they want to isolate that. And then, of course, you've got the home grow issue of taking that away because nobody, want people to be growing their own medicine once we figure out how to isolate it. And I can see that whole row in CVS, Dr. Berry, with little bottles of THCV, little bottles of CBG, CBN. That's all coming. That's what they want. And so they're trying to, they've already made THC a drug. Now they've made CBD a drug. They're going to make all the other cannabinoids drugs. Then they're going to hit the flavonoids. Thankfully terpenes are in everything, so maybe they can't do that. And then they're going to make everything from pissing yeast. So, that's fine with them as long as we can grow our flower, under the thumb of tyranny, local tyranny.
And as long as people can have small farms and go to make farmers markets,
right.
All of that's fine. But I will not abide the pissing yeast isolates as my only option.
But
that's
will
right.
not.
That's right.
I think, but that's genius to use the science to find out what, Israel's going to find out which minor cannabinoid is killing whatever cancer, and then you just take the genius that they are, the botanist, and create that plant from plant material, which they can do now too. So that I'm fully on board that. That's great. Use science for science, but then keep the two separate. Let us.
No, there's exciting things. There's exciting things happening. One of the dispensaries here in Florida has a beautiful 15% THC, 10% CBD flower product out of the ground.
Nice.
And that's a beautiful ratio. That's a 3-to-2 ratio with all the terpenes, all the flavonoids, all of it. So, when you have that, that's unique. So to me, I think we're just scratching the surface, quite frankly, when it comes to the botany.
Yeah.
It's an exciting time. Dr. Barry, we're gonna get into that afterburn that we love so much. I just want to thank you so much for joining us tonight and talking about these subjects.
Really dynamic time. Thank you so much.
Well, how can that be? I just looked up at the clock. I mean, that just shows you.
Listen, I think here's what I want. I want to make sure that we want to get Dr. McKenzie back on. I think this vaping issue is not going to go away. I think the propagandists are going to hold on to it.
You know what the only good thing about the vaping issue is, Dave? The vaping issue points out the importance of having access to whole flower. Right. And just as a physician, just to end it up, the most important thing about the whole vaping issue right now is that the safest way to consume cannabis inhalation-wise, I think, is absolutely the vaporization of whole flower product, right? Mm-hmm. And that's completely unadulterated. That's combusting the trichomes to effect. It's not combusting the leaf, right?
Right.
So, I think that's the important part, of it to that extent. And you're right. None of this is going to go away. Technology isn't going to go away. Listen, one last shout out. I am going to be in California in a couple of weeks, as you know, coming out to the CanMed.
Yep.
And I am so excited about that. I got, like I said, every finger and toe crossed to make sure that Dr. Bachulam joins us.
Us too.
Anybody that's going to be at the LAX airport on Sunday afternoon, give me a shout out, because maybe we can carpool over to Pasadena, make a couple stops on the way or something like that. But I cannot believe that
you guys should stop by the studio on the way.
That's we were talking about that
already.
But we might be over there already.
Oh,
we'll have to do a show from CanMed.
We'll figure it out
because we have press passes. We'll definitely figure it out. And Dr. McKenzie is coming as well, right? I believe. Yeah.
But he's coming in a couple days earlier, so we're not flying together. So
okay.
Well, we're definitely gonna hook up. We're gonna hang out with you guys. We're gonna get you on camera. We're going to check in throughout CanMed, so we're certainly going to do that. We're totally looking forward to meeting you in person.
Yep.
This was an amazing, informative, and we could go again. We could keep going.
Alexis Portel says, and grow your own.
And grow your own.
And
through the plants, through the people.
Listen, I like to think that I'm one of those people that kind of like to stir the drink. So that's why when I find people like you, I want to make sure that I know who you are. You know who I am. Alexis Portel's a common friend now.
Yeah.
All of us can make big things happen, and that's my goal.
That's right. And well, it's all like the plant. The plant brings people together.
Always has.
Always has ever since it's been used, rolled up or smoked in a pipe. The flower. The original vaping device was for dry flower. There you go. That's the safest way to do it. We talk about that. We don't like the isolates. This is a reefer revolution as far as we're concerned. We enjoyed sparking up. That's our favorite way.
I have 2 joints left for the afterburn.
We do. And more evidence is coming out that is one of the best ways and most effective for acute pain, for PTSD, and studies are starting to come out. Hopefully we can start to use more and more of real good cannabis if the DEA can get off its duff
Sue
and
Sisley,
make the research happen.
Another common friend, guys. Dr. Sue Sisley won her case with the DEA. So good things are happening. Guys, I can't wait for the afterburn.
Awesome. We'll see you soon. We'll do panels.
Talk before then.
Thanks, Dr. Barry. We'll see you next time. Enjoy the afterburn, everybody. Thank you very much. We're going to start with the afterburn. I'm just going to say, I got to gather my thoughts. I'm so excited.
Yes.
That was great. Thanks, Dr. Berry.
Thank you.
We'll see you
Thank
later.
you so much. Glad you're safe from the hurricane.
Oh my God, we
Glad
didn't even
just
say
passed
that.
over.
Yeah, you're safe from the hurricane.
So
You're safe.
good.
Thank you. I mean, we're glad you're safe from the hurricane. Everybody's good. You know, it didn't hit Alabama either, so that's
and
good.
thank you, Dr. Biscuit, Dr. McKenzie. Thank you for connecting us with Dr. Berry.
Oh, absolutely. That
Great.
was awesome. And we could
Cool,
literally,
everybody. We could totally
we
talk
could
forever.
go on, and that was amazing.
Oh, that was
every
fun.
subject.
Totally.
And hang on a minute. I'm going to.
Totally fun. Thank you.
All right, guys, free the plant, free the people.
Yes.
Our plant has been repressed.
I'm gonna bring them in for one last show.
We're bringing the girls in for one last afterburn.
So it'll take a moment.
Stay tuned, everybody. Thanks again to Dr. Barry Gordon in Florida, and big cannabis doctor in Florida, gave us some great information. We'll be back for the afterburn. We'll see you in a few minutes. Free the plant, free the people.
Thanks, everybody.